This episode is brought to you by Yin and Fang toothpaste. Yin and Fang toothpaste is 4 ingredients: coconut oil, baking soda, cacao butter, and nanohydroxyapatite. It's non-toxic. There's no preservatives. It has a low abrasivity, which preserves your teeth. It's supportive of the oral and gut microbiome, and it's remineralizing. Stop. All right, guys. Today we have an amazing guest I'm really excited about. Erin Arnold is here from Central Texas Myofascial. She's the founder and owner. And you are an expert in so many things: fascia, physical therapy, pelvic floor, holistic healing, energy work. I don't know, probably a zillion things I don't even know. And we're going to get into all of it. Why you're walking around with restricted fascia, how you hold trauma in your body, all the healing things. So thank you for being here. We're really excited.
I'm happy to be here with
Yeah,
you.
this is really fun. We've had a long-standing relationship with Erin, and she has healed Whit and I multiple times, and she's kind of our go-to. So we're really excited to have her in the hot seat, ask the questions that kind of probably most people don't really know about. Fascia is a really kind of, it's more of it's a newer thing. I think that fascia is not new.
Yes,
The understanding is more new. Yeah. Okay. So before we get into kind of nitty gritty or other things, why don't you explain how you got into this in the first place? Was the fascia and PT always a passion, or kind of how did you drop into this space?
Yeah. I went to PT school thinking that I was going to do sports med. I played basketball. I played softball. I blew out my knee, I think, at the first time at age 13, and then every year almost through high school. And so I knew that sports wasn't going to be a thing, but I was like, I could do that PT thing because I'd had it. So I spent my entire PT education thinking that I was going to go into sports medicine. And then my last clinical rotation, I had what our quote unquote best sports med-fill was for my clinical rotation. And I was like, there is no way I could do this every day. I was seeing 40 patients a day as a student.
Wow.
Okay. Working 10 to 12 hour days. It was just management, 15 minutes. Okay. You had a new patient coming in every 15 minutes. So this person was going to be on the bike. I'm going to give this person TheraBand. This person has a hot pack, because you can't actually, in that model, you can't actually give quality care. It's a numbers game because it's, insurance and reimbursement. That's a whole other conversation. But I was like, I'm not actually doing anything. Here I went to school to learn all of these things to be able to help people. And I was like, I am just doing time management, and time management is not my forte, right? So I was like, what am I going to do? I have student loans. What am I going to do?
Yeah.
And so when I started looking for jobs, I'm like, okay, if I don't want to do sports med, what do I want to do? And I was like, let's just pick a cool city to live in. And so that's how I found Austin, right?
Yeah.
It was on my top 10 cool cities list. And when I interviewed here, the lady took me to the bluebonnets were blooming. I mean, it was like March. It was like perfect weather. I saw Willie Nelson at Stubbs. I was like, oh my God, this is the best place in the entire universe, right? Yeah. But I ended up working in long-term care. I worked in nursing homes, my first job.
Oh, wow.
Right?
Yeah.
Which Pebble Down has helped me so much as my parents have aged and has given me all of these resources, which I never would have expected. But 6 months into that, they made me a manager. Another 6 months, and I was running multiple buildings, and I was about to get promoted to running the state of Texas. This is a year and a half out of school. Nobody has any business managing people a year and a half out of school. Especially if you're an overachiever, nobody should do that.
Yeah.
And what was happening was my body was completely falling apart. I was sick to my stomach literally every single day for 9 months. They had done scans. They gave me, I mean, everybody asked me if I was pregnant. I'm like, I'm not pregnant every freaking day. And one day I was just driving down the street and I see this massage therapy sign on a building with a number. And I was so desperate that I called it. Like, I was like, what is happening?
Yeah.
So I was like, hey, can I get in for a session? And they're like, well, we're usually booked out for 3 months, but we just had a cancellation. Could you be here in 5 minutes?
Mm-hmm.
And I'm like, I'm literally right in front of your building. So yes, right? And I walked in, and the practitioner who was there was like, I actually specialize in something called myofascial release. Have you ever heard of that? And I said, we had one lab in my entire, program of physical therapy school. And I was like, all I remember is hip flexors. Like, maybe there's like hip flexor tightness. And I was like, I think mine are probably tight. I don't know. And she's like, okay. And so I got on her table. Mm-hmm. She sunk into my system. And when she sunk in, it went directly to the area that I'd been sick every day for 9 months. Mm-hmm. And in 5 minutes, it was gone.
Yeah. And
I was like, I don't know what that was, but like, this is so meant to be. And I was like, what is this? What is this? And that's when she introduced me to myofascial release, kind of the John Barnes method. And pretty quickly after that, I went to my first course. And then I was like, how do people do this? Like, because being in kind of an insurance-based model where you're seeing 40 people a day, like how was this clinic seeing one patient at a time? Like, how does that even work? Mm-hmm. And I ended up taking a couple more classes, and then 6 months later, I was doing it full time.
Wow.
So it was really quick. And I think that like there's all these little beautiful forks in the road. And I could have done so many different things at every fork, and really listening to where I was supposed to go next just keeps leading me in the right place.
Yeah.
And then with, as I got into the myofascial work, right, people were coming in with all these pelvic floor disorders. Mm-hmm. And I didn't know what to do, but I'm curious and I can hyperfocus and I can learn. Mm. And so like with each person who would come in with something I didn't know or understand, I would just go learn.
Yeah.
And that has turned into my whole career.
Yeah. That's so cool.
Yeah. Being curious is such a good trait. And I mean, everyone's curious, but like, are you willing to chase down your curiosity? And like in your case, it led you in a whole nother career path.
Yes.
It's really inspiring to like hear that.
That's so what I love about the work that you do. And I love that you're kind of the path that took you down the myofascial path for yourself really started on this, like the connection between the fascia and like healing something in your stomach, right? Mm-hmm. I think there's a lack of understanding of the connectivity of all of this, and how so many things that happen in our body are it's not just a muscle or a bone, right, or a pit in your stomach or a headache, right? It's like your nervous system is connected to all of that. 100%. And the fascia plays, well, it's all connected, right? When we start talking about fascia, each of these individual things, but how powerful it is to see that in your own life, where someone could manipulate the fascia, right? And maybe a little energy healing. I mean, there's probably some other things, 100%, right? Which I want to get into for sure, because that was, just as an aside, when Whit came to see you for the first time, I was like, Whit had he had chronic stuff from dentistry for like a decade. He came to see you. You literally like, put your hands. He was like, she barely touched me. He came out and called me. He's like, I don't know what she did. That was some kind of magic. And he had mobility in this part of his body that hadn't moved in 10 years, so. And I think it's more than that, right? It's so.
I was 40 years old and not able to sleep on the left side of my left shoulder at night. And I'm a dentist. So I'm starting to think about, what does my disability policy look like? Right. Because like, if this has changed so much in the last like 5 years, give it another 5 years, where will I be? I probably won't be able to turn my head at all. Right. And now we're 5 years later, and I have been sleeping on both sides comfortably for many years.
Yeah. So before we get into kind of describing, there's so many pieces here, but let's just start off with like, what is something that you feel like is just BS about something people believe about body work? Like it drives you nuts. So many things, I'm sure.
I feel, and even like within fascial work, like when people say fascial work, right? I always say words matter and they don't unless you're meaning the same thing, right? But there are so many times where people are so flippant aggressive and they think that they have to manipulate or do something to a body. And I think what I learned with the fascial work was how to actually perhaps ask the body what it might want.
Yeah.
And work with it. And so I'm on the same team with the nervous system versus being kind of in like an offense defense type situation, because I feel like people are generally just way too aggressive. Like they don't have to be. And I also understand why they are, because I understand the nervous system, and that increased, like new, more input gets to the brain, to the pain areas in the brain faster than the feeling they've already been having. And so because it's a different feeling, we experience it as relief. Because we're not hearing the same thing. But once that input is taken away, we haven't really changed a lot of the structure, what's going on, or the patterning. And so that's why it keeps returning.
Yeah. So that's so interesting, because this is what I personally have found. And I think you can find healing depending on what's going on and who you are, and in lots of different modalities. So this isn't to just like rip on massage, but massage, like deep tissue massage, used to be my go-to when I would have like aches and pains from working out, and typically from working out. And once I found you, I recognized that, you know, it was always like, it would feel good in the massage, right? The like, exactly what you're saying. Yes, so it hurts. Good. Right. And then, yes. But then it wasn't really dealing with the issue, right? It wasn't, you would get some sort of relief, but it never really seemed to be healing. So, the tightness or whatever it was, right? And it's, I think that's such a good example of what you're saying, that like when you're trying to kind of force something, you do get some sort of relief from it in the moment. But then long term, I just was finding like, well, this isn't really solving the problem, right? And so that's once I learned about I eventually actually in yoga learned more about the fascia on my own. But yeah, from coming to you, I think the learning how it's all connected and how it wraps the muscles and the connection to the nervous system. So let's just start there.
Can I pause just one second, yeah, totally. Right? Because I do want to like not bag on anything. And some of it is, what is the intention of it, right? Like if you think about deep tissue massage, like sometimes that's called sports massage. Like if you are an athlete and you have a cramp and you are trying to get back in the game in the next 2 minutes, like that intense input may change to allow somebody to go back and do the activity that they need to do. Right? Yeah. So there's a place for that. However, that's probably not long-term.
Right.
What's happening. So there's also like a time factor of like the people that you're seeing, there might be different reasons different modalities work for different things at different times. And they're all okay. Like they're all okay. Nothing's wrong. Nothing's right. It's just different.
Yeah. Yeah. What a good point.
Yeah. For sure.
So
wait, I want to ask, in your initial encounter with the person that you were pulled in the parking lot, you said she sunk into my system.
Yes.
Like, so just expand that a little bit. What does that mean when someone sinks into your system?
Very good. Okay. As a body worker, I have not learned how to put my hands on somebody other than on their skin. I can't actually like get directly like physically onto their liver or something like that, right? Right. But when I put my hands on people, I'm always like, I have to be on the surface, but what I'm really interested in is what I call the ooey gooey center of you. Like what's between my hands is you.
Mm-hmm.
It's like the skin is an input. So, we could have a whole conversation about senses, like we think about the 5 senses, but we have so many different senses that are available to us. And this proprioceptive, the touch sense, and being able to put hands on people and then think about sinking through the layers of, oh, wow, I'm feeling something a little here. And then using your anatomy knowledge and everything else to be like, oh, okay. Is that one structure? Is that like, I know where a certain muscle is, or a certain organ is, or a certain blood vessel or nerve. Is it that? Like, how does it feel? Like, does it feel muscular? Does it feel tubular? Does it feel stretchy? Like, what's happening here? Or does it run in a direction? There's so much that can happen within a tuned in practitioner's hands about what's happening in the body. So we talk in the fascial world a lot about the fascial depth and the fascial barrier. So if you were to, when Barnes teaches like the most like basic all-purpose myofascial technique called the cross-hand release, okay? Basically, you take your hands and you put them on the surface of their body, and the first thing you do is nothing. You breathe, you connect, right? Because there's no will, right? We're listening to the body, so we're really tuning into those proprioceptive senses. And then without pushing, we start to sink our hands into the tissue like we are sinking into clay. And we ride that until we kind of feel like it's like, I always say it's like taking an elevator down to the basement. And once I hit to the basement, I can wait there, and that's kind of the fascial depth barrier. And then I might kind of just tune into that. And then as I open my hands away from each other, then we kind of get into the other fascial barrier, and you'll feel a tug right there. And so often it doesn't really necessarily look like my hands are doing that much, which is why you're like, I don't know what the hell she did, right?
Yeah,
like, especially if you're used to like deep tissue and you're moving through, right? So when you're sinking down and you're opening, now you're starting to connect into this fascial web, which is this 3-dimensional connective tissue web that goes everywhere in their body, head to feet, front to back, from the skin all the way down to the cells. And you can start to feel, it's almost, people ask me all the time what I feel, and it's kind of hard to explain. And I think probably every practitioner is different, but it's almost like I feel a whole like connected system. I don't know, like maybe like a subway or a tube or a cave system or something like that. You can feel where things go. You can feel where things flow. You can feel where they don't flow. Like you just have this sense. And as you wait at that barrier, it starts to soften. And as it softens, you'll feel the sensation almost of like butter melting or taffy stretching in your body or under your hands. And so that's what we call release. Sometimes we can again, words matter, but they don't, right? Because pushback will be like, okay, you're not actually releasing fascia. And I'm like, I like to think of it more actually as a reorganization of the connective tissue web versus it like being, I'm cutting it, or I'm like getting rid of an adhesion. It's like I'm changing the structure of it and I'm changing the environment around it to create more fluidity and flexibility in the entirety of the system. Does that make any sense?
Yeah.
Okay.
Okay. Can you explain like you would to a 5-year-old, just kind of, you did just give kind of a explanation of what fascia is, but can you explain it a little bit further of what it is, like what it does, and like very basic, anyone can understand terms?
I would love to do that more effectively than I think I can, right?
Give it your best shot.
So if you think about it just structurally, okay, I highly recommend there is a a physician from France, Dr. Guy Berthaud, and he has the Architecture of Fascia book, and then he also has a couple movies. One is Strolling Under the Skin, one is Muscle Attitudes. You can find clips of those on YouTube. It's a little dry, but he was one of the first people to actually take video of living in vivo fashion instead of it being like cadaver fascia that's all dehydrated, and it's a very different structure, right? But it creates this three-dimensional web that acts as a shock absorber and a force distributor, right? So instead of it just being like, oh, wow, I've got an injury here, that web, that network separates the forces so you don't get it on one area, right?
Yeah.
We postulate that it can be also like another conductor of energy or nervous system activity. Barnes will say that when you have an injury, like the fascia will start to dehydrate and stick around an area in order to protect it. And if we get the all clear, shakes out, everything's okay. But if we don't, which is what happens in most of our lives now, right, it can continue to pull through that fascial web. And it's almost like a snag in a sweater where you might have an injury at the hip, but then it starts like pulling into the shoulder, or, oh, wow, now I've got something at my neck, right? It looks at the system of the body in a much different view versus just, okay, this muscle goes from here to here. So if I have a problem here, it has to be this muscle. Like here, like somebody could have a knee injury and that relate to their shoulder, which is not how we would normally assess a body, like through traditional PT, medicine, that sort of thing.
Oh my gosh, that was so awesome. So
Yeah.
I was just actually visiting with another physical therapist last weekend while our kids are in football camp.
Yep.
And I have an interest in mouth guards, as you know.
100%.
And we were talking about concussion prevention.
Yeah.
And the first day we had this conversation, the next morning he like came back and he's like, I did like a lit review last night because I was so interested in this concussion reduction. Yeah. And he pointed me towards like this new meta review of like concussion reduction, and the number one feature to reduce, or like method to reduce concussions, was neuromuscular warm-up exercises before like the sport. And like you and because the mouth guards was in that. There.
Like what kinds of stuff were they saying?
I don't know like the specific exercises, but it was just interesting that you used the word shock absorber. Yeah. And this like web that's like somehow connected through the nervous system to the muscle, the muscles that are moving the skeleton that hold the brain. Yeah. And like the fact that like, I'm not sure what these specific exercises are, but the fact that it's like, they're showing that tying into the nervous system before you go run into another person and get the nervous system ready to maybe anticipate these shocks seems to help reduce head injuries. So I don't know if
my brain spirals. I always am like, I don't ever want to do research. I just want to be like in this like think tank where I'm like, I wonder what would happen here or whatever. And I like create all these research studies in my mind, and people are like, you have to find funding, and like, this is a problem. And I'm like, ugh. Like, I feel like they're so limited because I'm like, like I want to know about eye movement, right? And like how the nerve that's coming off the back of your eye connects directly into your brain, right? Or the dura is the covering of your brain and your spinal cord. So when people have an epidural injection, right, it means that they're having an injection under, that's epi, dura, right? And so this dura is this covering of the brain and spinal cord, and that's where our cerebrospinal fluid is running. All of our nerves exit this dural tube. It goes over our brain. And when I think about concussion, like when you're getting an injury to the head, and then often the brain is like sloshing around, and oftentimes you'll like get an impact on one side, but the force of the brain coming into the other side is often what is happening. And then sometimes you get a slosh back. That's a counter coup. Like, and how if all of that is sticky, it doesn't have as much give to be as fluid. Yeah. Right? So it's like, it's more like running into a tree. Like if you're in your car and you're running off the road, you can run into a tree or you can run into a field. Yeah. Right? And that's a very different response, even if you're going the same speed, right? So how can we distribute forces? I'd be so curious what they did.
Yeah, it fascinates the way these football guys describe, like they hit their head or they get hit by somebody. Totally. And then like they'll oftentimes say it's the secondary impact of then they fall and their shoulder like hits their chin, which slams their lower jaw into the upper jaw, which then secondarily rattles the head. Yes. Anyway, I have a question for you. Yeah. This I think is interesting. So, do you ever have scenarios where somebody comes to you and they're, like my hip hurts or like maybe my shoulder hurts, and traditionally we think this is some like physical ailment, but it's actually like, well, this is because you're lying to your wife, or you're a closet alcoholic, or like you like something, I don't know, like weird stuff that like
emotional issues.
Yeah, like emotionally, or
that's stored in the fascia, or I guess anywhere in the body.
Yeah.
Yes. I mean, I'm a pelvic floor physical therapy. We talk about all the things that are stored within like the pelvic floor. It's a whole other thing. So we talked a little bit before coming on that I like to look at things at like a macro and a micro level all the time. And we have to zoom in and zoom out all the time. Mm-hmm. And have I seen it? 1,000,000%. Mm-hmm. Would I dare say to somebody coming in that that's the cause of it? No, because I don't know. Yeah. Right? That's an individual person having an individual experience. And I think where we get in trouble is when we see things in certain people, we extrapolate that to everyone, and that's always going to be a problem. Mm-hmm. And even in our own systems, we're an N of 1 in a research study. Like when we start thinking that the way our body is experiencing things is the way that everybody experiences things or anybody else experiences, that's where we get into trouble, because it may or may not be true.
Yeah. Mm-hmm.
And maybe even what we're doing to our own selves is not true. So the answer is yes. Sometimes it is a trauma. Sometimes it is a surgery. Sometimes it is a car accident. There's something called myofascial unwinding, which is more a little bit of the energetic piece versus a structural piece. But what will happen is someone has to feel very safe and know that they're not crazy, because otherwise this won't happen, right? But their body, once we tune in, will sometimes start to spontaneously move in different positions and directions. And sometimes that is in positions of injury that they've had. So you were talking about the football player who got like landed here or here. I've watched people relive different parts of their car accidents or diving accidents. People will flip upside down and flip off the table and do all of these things as their body is like in a safe place to kind of process some of these things that were happening to their body when their nervous system was just keeping them alive by disassociating. Yeah. And so that coming in and being able to process that in a safer, supported environment can be super healing. Now, does everybody do that? No, and that's okay. Like there's lots of different ways to help people, but it's fascinating. Like I've had people where, I mean, I remember being really early in my career before I really understood it. And I'm treating this woman and I'm like, do you smell pickles? Like my whole room just smelled like pickles, like pickles. And I'm like not a huge dill pickle fan. I was like, ugh. And she's like, and she got real quiet. And I was like, did I screw up here or whatever, right? And then we went on through the session. And she came back a couple weeks later, not even in our session. She's like, I need to talk about what happened. And I was like, okay. And she goes, when I was young, she had sadly a lot of abuse in her life. Oh my God. And to hide, she hid in the canning cellar with the pickles, all the pickled stuff. Wow. Right? And so that smell was like locked in that tissue. And as the tissue was releasing, you could smell pickles. I've seen like car tracks on people's bodies as like, but got run over by cars as their tissue is coming out. It's like it comes up and out. Anesthesias, people have like pulled out drainage tubes, like all the energy of that sometimes is still there. Now, I'm not about to say that that's the case for everyone, but it's so fascinating that it can be. We just don't know. This is why I'm so humbled by the fact that I really have no idea what's going on with somebody. As much as I know, I have no idea.
Yeah, and we said that before we started filming, that we were talking about things, and you through your experience, I'm kind of trying to say this back.
Yeah.
You realize that a lot of people actually don't know shit. Like, like we think we all know everything, but like then through experience, you're like, wait a minute, we know very little, or we don't know it all, and it doesn't apply to everyone, like you're saying. But I think my comment was like, but when somebody helps you and you got better, you're like, well, that helped me, right. And that's like we both feel that about the treatments you've done for us. And when you've worked on me, you're not pressing hard. I don't think. I don't know. I go to this weird spot. My eyes are closed, and I feel like I'm moving in three-dimensional space. Like I literally, it's like this out-of-body feeling where there's like a screensaver on computers where it shows like triangles and shapes moving in three-dimensional relations to one another. And I feel like I do something like that. Like I literally feel like I'm moving, and I can feel like almost like ripples of release, and it like sends waves through my body that then send me spinning. And that's what I feel frequently when you've worked on me, which is like, I mean, it's just weird. Like, I've done something similar, like in a sound bath when my eyes were closed when we were down in Mexico. I had a very similar like spatial movement thing. But that's just like,
that's so interesting, because like it's exactly what we're talking about. Like everyone is so different. You have no idea what they're experiencing. And like when you and I are working together, I'm feeling everything, right? I can feel the shift, but we're talking, and it's always, we're talking through something. Like I come in with some ache, and then something comes up in our conversation that like usually I don't even realize I've been hanging on to, and that's like the thing that I'm like harping on, right? And yes, I get there is a physical release that's happening. A lot of times it's in my, like, just because I do a lot of yoga, like my hip flexors, or it's a shoulder or a neck, or like, but always when I leave, it's this release of the emotion, as at the same time as, yes, now I can move again, and I'm not in pain. I usually don't come in severe pain, but I don't have like the stuck area. But it's really like I was stuck in something else, right? Which is, I mean, that is like the magic of this work, which is why there's such an element. It is the fascia, right? Like you are manipulating a physical part of the body, but and I've felt this from the beginning with you, is even when you sit and you kind of like take stock of the person in front of you without even putting your hands on, like you usually put your hands over
sometimes
to feel,
yes.
Feel the energy, right? And there is, can you talk about kind of I mean, I feel like it may be hard to talk about, but is that something that you learned from training, or is there another element that you've done of like energy work where you're kind of incorporating the two, or is it just like over time you've learned to feel what's going on in that way?
It's a really good question, like that my husband asks me sometimes, or people will ask me, and I don't know.
Yeah.
Right? Like sometimes I go, okay, it's what I will generally say, big picture is a combination of everything.
Yeah.
Right? And I think about just my general sensitivity. I think that my sensitivity knob is way finer tuned than most people. which is a blessing and a curse. And a lot of times I have to kind of like shut it down so I can actually function in the world. Otherwise, I would be feeling all of everything all the time, right? I think that each thing I've done has given me more permission that what I'm feeling is actually real. It's not made up, because I can, I can make up that I'm like feeling something and I'm like, I'm crazy, or this is crazy, or you can feel that way. And I'm like, no. And then this is where I love the science part of my brain, because physics and waveforms and energy and all of this stuff, it's like, oh, there's all kinds of reasons for all of the ability to feel these things. We just don't always tuned in.
Right.
Do you think that some people are telepathic? Do you think you have some like telepathic abilities? I just recently was hearing about like autistic people.
The Telepathy Tapes podcast. It's fascinating, isn't it?
I haven't dove into it yet, but
I don't know.
like we've even had a medium, someone tell us like one of our kids was connecting with someone that passed from our lives. But like, okay, take off, get my life back out of it. I want to ask you, do you think you have some like telepathic type abilities, or do you think that's a real thing, or like?
This is such an interesting thing, and why I've been, I think, scared to like go on podcast, like people have been talking, right? Because I'm like, people are going to have all kinds of opinions about me, and I don't even know, and like, I don't want to judge.
Well, like, you had two patients vouching that you are very effective. So
yes, this is why I'm here. I wouldn't be with people I didn't know talking about this thing. I think that we have different sensitivity levels, and whatever we label that is a label. Might I have been burned a couple hundred years ago for my abilities? Maybe. Like, I think that I think sadly the sensitivity in us is not necessarily nourished and developed when we're young. I mean, think about like even think about your day. Like, what are we doing with kids? We're activity. Like, very, like, we're like trying to get kids to T-ball, but we're very rarely like, how does that tree feel?
Yeah.
Right? Or like, ooh, how do you feel when you walk into this space? Right? So I think that we can train ourselves in and out of lots of things. And part of it is just what you're putting your attention to. And I think the gift of my practice is just all of these wonderful, beautiful souls keep coming into my life to be co-creators and teachers for each other, so we can kind of develop together. And I don't think it's a singular effort. I think it's a collection of all the things. And it's just this ability for me to practice and refine and be more open to the fact that, oh yeah, there's connections to someplace. And sometimes it's really easy and sometimes it's hard. And it's like, what are you a vibrational match to? Because that's, again, physics of resonance, like the waveforms of like, what are you in phase or out of phase with? And you're going to hear it.
Yeah, because I like asked that question because you like hinted at it a little bit in different ways. You were like, well, there's the five senses we talk about, right? But then there's these other senses. Yeah. Right. And I just think I've also heard from our child that like came to us and was like, yeah, I've seen and he didn't know who it was because he never met him. I've seen my friend that passed multiple times in the closet. He's nice, just smiles, like whatever the interaction was, right? And then it's totally separate, like, person told us, yes, your son has seen him she didn't know that. Like, how does she know that? How's that happen? And then like through conversation, similar thing. It's like some people have these senses, and like, he seems to like have this ability to like connect with animals who don't use verbal language. And it's like there's some sensitivity, communication. There's some other communication that's happening there. Like, like dogs can tell, are you the dominant one? Are you scared? Like horses, I suck at riding horses because they all know I'm scared as shit when I'm on a horse, but like I didn't tell them I'm scared.
Yeah, me too.
Because horses are the best like energy barometer because they're big. I think horses, elephants, whales, I love them all, right? Because their energy fields are so big and they are just asking you to feel yourself. And they're like, don't come in here with that.
Yeah.
Right? Like, come in with your grounded self and we'll be fine. But if you're going to come in all bajiggity, I don't feel safe around you.
Yeah.
I'm out.
Yeah.
And that happens in relationships,
100%.
right? Like if there's dynamics amongst your partners and work relationships, marital relationships, whatever, right? Like that we're all sensing these things, but we just like don't turn it into communication regularly.
Yeah. We can have more of a conversation offline about this, but I think too, like if people's response to those gifts when people are young can help shape their development or stunt their development or delay their development. But yeah, I believe he probably is.
Yeah.
Yeah.
They're gifts, not quirks. This is a gift. Like this is awesome.
I think all kids, to your point, you can be trained in or out of something. I think kids are the perfect example. You watch them come in with all of these, they're sensitive to everything, right? And they can, if you're recognizing it, you can see that they notice and can feel things that you're not feeling, but then they're told constantly to ignore it, right? Like, like you feel that, but you're going to go anyways. You are like, you don't feel safe here. Like, it's fine. Everything's fine. Everything's fine, know?
Right.
And I mean, that's one of the reasons that we homeschool is because our middle, who he's talking about, is he started going to school, and as we would approach the building, he would start crying. And he was like, I don't know why I'm crying. It made no sense, but and he's very like, we'll go into a space and he will get uncomfortable and we'll leave, I mean, he's just, I know with him, he has kept that ability and it's very strong. So I've learned to respond and not ignore. But for most kids, like you're saying, it's like, you're going to practice, you're going to school, you're going to, and then what happens over time is you lose that sensing ability, and maybe it's there, but you don't trust yourself anymore.
Well, isn't this the perfect segue to like what we talk about with functional medicine about like listening to yourself and signals? I think like regardless of this conversation or whether people like want to believe in like kind of extrasensory stuff, I think that there is a huge piece of we are trained to stop listening to ourselves and whatever. Like so many times when people come in with I like to call them sensations. I like to take I've really been trying to take like the moral good, bad out of everything lately in my practice. And I'm like, ooh, this has interesting implications. Like if you're feeling a sensation, if it's a different sensation, that can be scary. And so we see it as bad. And I need to get something that I need to get rid of, right? Instead of a signal of like, oh, wow, my body's talking to me. Now, I may or may not have the language or understand what it's saying, but it's always talking to me, right? And I've come to the point that like this meat sack that I'm in is literally the only relationship that I will have my entire life. And how I have not always been a great relationship partner to my body. Like I've been directive, like, like in your own marriage and growing up, you're going to be different kinds of partners to your, to yourself and others. But it's like, oh, all you're doing is trying to talk to me. Like, and to trust that it's actually saying something. And we get so trained out of that I think that's where we kind of get into trouble. So whatever modality we're using, there's so many different things that all work for people. They're just ways of bringing in communication back to yourself, I think. Do you follow that?
Yeah, totally. That's
Okay.
something I say all the time. People you essentially at some point, I think you get trained real early on, as a kid, you're told to ignore when you feel bad or, whatever, to ignore those feelings. And then it's like I always think it's most obvious for me when you become a parent, and it's like you hand your feelings over to the doctor, or and then it's your OB, then your pediatrician, then, and it's, you're constantly having to ask someone else how you're feeling, or what's going, or not how you're feeling, but what's going on in your body or your child's body.
Yes.
And what happens over time is you have no grounding sense of what's actually going on, because you don't even think to ask yourself. You just immediately are like, who is the expert that knows this part of my body? What's the knee expert? Who's the elbow expert? Who's the nose expert? So yeah. And that you just stop talking to or you stop listening to your body. You're talking to it all the time. You stop listening to your body. Right. So, and that causes all kinds of issues. And like you're saying, yes, you can go, from my perspective and the experiences I've had in my life, everyone can have different opinions, but you can get to a lot of these things through maybe something's going on in your stomach and you start with nutrition, and that's like your way in, and the body's like, thank God, I'm going to respond because I haven't had vitamin C in years or whatever.
Yes.
Right. Or you can start with sleep, or you can start with manipulating the fascia, which sends your nervous system a signal that like, oh, I'm paying attention to you, what's going on here. So, functional medicine is we're very big proponents and excited about it, because it's bringing medicine back into the sphere of tell me what's going on, instead of like, I'm going to tell you.
And also, I just have a lot of empathy and grace for people within the medical system, right? Like sometimes there can be like a demonization of doctors and big pharma or whatever. I honestly just don't believe that people are trying to be assholes, right? But how unfair when we may not be able to talk to our body, that we then give it to somebody else, and now they're expected to tell you. Like, there are too many missing links in that chain. Like,
100%.
And how are they supposed to, like, they can't, we've put them in an impossible situation. And now, now they have 5 minutes to talk to you, and like no time to follow up, and 5 million patients. There's no time to think critically about the problem. Like,
they're like, give me your 5 symptoms, and there you go.
So it's like, I'm just trying. All they have. Like, it's the system with which we work, and there are plenty of people who are not ready to be curious, or don't have the skills, or like just can't for any number of reasons, and that's totally fine. We're all trying to do our best, but it's like, as I kind of think about bodies or health or wellness like a trail system, because I love to hike, right? Or just like a loop trail with a bunch of different trailheads. And we can enter that trail from many different directions, and we can have trail guides for different sections of the trail. Very rarely will they be the same guide all the way around, but we can learn different things from people who have kind of trod and created the trail. Yeah. And then you're going to notice like, oh, I don't think that path is for me. I wonder if I can hack my own new path, or maybe a couple people start to like create a new little path off the traditional path, and you can take that one or you can take this one. It's okay. Like, everybody's just
I definitely agree. Like, I love the comment about not beating up on all the providers. And at the same token, like the reality is, like, within our training systems and evidence-based care, it's narrowed us down to these treatment protocols for whatever the symptoms, or whatever the diagnosis is. Here's your symptoms. And I think we would benefit from stepping back to before that model, because the evidence-based funnel doesn't always
do you
give
feel
the
like
best.
I totally hear you, and I'm not sure that model really existed, because I think about even my training. I'm just a little bit older than y'all, and like PT was 100% a cog in the wheel of the patriarchal medicine system. Like, the doctor had to give us what to do. We weren't our own professionals, right? And so like PTs are like, wait, like I've got a whole lot more skill, right? But I think like the internet wasn't a thing when I was a kid.
Yeah.
Mhm.
Right? Like we have to remember where we are in history and like how we were siloed, right? And now that we are opening up, sometimes there's more information, but without context and wisdom. And so I like to think that we're on the leading edge of change, but this change really won't be kind of within the connective tissue for some time.
Mm-hmm.
And that's frustrating when you're like, you're on this edge and then you're like, come on, just come on. Like, this is the way.
Yeah.
And I think, okay, well, I'm just going to leave little crumbs and pebbles. And if this feels like the path you want to follow, follow. And you're probably going to diverge, sometime. But like, I think we just want to help people so badly and we don't want to see people suffer.
Yes.
That sometimes we speak from a place in a language that they can't follow us.
Mm-hmm.
Yeah.
So how do we make it accessible? How do we bring people along? How do we help little bite-sized pieces of information for people to try and reconnect back to themselves?
Yeah. Yeah. So I'm going to turn
Thank you.
the,
I kind of went off here.
no.
No.
I don't think, no, that was really well said. And I think we agree. Like, so I want to get into something else because you are an expert in pelvic floor, which is very interesting to me. And the reason I initially came to see you was I was sent by my incredible midwife, GB. And because I had an issue in my second birth where the baby, like my water wouldn't break essentially until very late in labor. So she sent me to you to do some pelvic floor therapy, and I'll never forget that you were, you did your work and I was like treatment. I don't know, you worked your magic and you were like, okay, you come back and see me like 3 times or something. But I was like, what did you find? And you were like, you don't need to know. Like you were like, you're good to go. You basically were like, you're good. You're going to have an incredible birth. And it was like, I was like, what an awesome answer to someone who is, didn't need any fear in the process, and I just always remember that. But anyways, going back to what I'm curious about is the fascia, how fascia is involved in kind of like sexual health and pelvic floor, obviously. Or obviously to me, right? It's part of the whole thing. And there's a zillion different roads you can go down with like pelvic floor therapy.
Very much so. Yeah.
But I think one of them that's obvious in all this is sexual health and kind of how you've seen that play a role in, I don't know, like a crazy story that you've helped someone with through that in their sexual life or something like that. I don't know.
Okay. Buckle up. The reason I'm pausing is, let me just kind of give you a little primer. Pelvic health, the first pelvic health PT classes were not offered until the late 90s, like when I was in PT school, right? So basically you had a bunch of physical therapists, mostly women, some of them who would have like urinary leakage after having their babies. And they're like, there are muscles down there. I'm a rehab provider. I bet I can figure this out. Right. And nobody knew what they were doing. Like literally my first teachers is like, basically just kind of get a finger in there. See what you feel. I'm like, okay. Right. The field of pelvic health is filled with the greatest bunch of nerdy, detective, loving, wonderful people I have ever seen in a subspecialty in my entire life. And we are just like dying to help people. So generally with pelvic health, I because I think people don't know, sometimes I think the most common things that people know that you can see a pelvic floor physical therapy this for is mostly urinary leakage. Okay. That is just one very small subset. Okay. We also deal with pelvic pain. So that can be nerves, muscles, like the hormonal tissue quality of the actual parts of your body. Vascular, there's so much differential diagnosis that goes into pelvic health and is continuing to expand. Okay. So I want to say that as a subset, and like we're still learning a ton. There's still a lot we don't know. If you went 5 years ago and you're still having trouble, go back again, because I feel like the field is advancing so much every single year. Like, that's my caveat.
So let me just ask a pointed question.
Yeah.
If you have, like, if you've had babies and you have trouble, or like you've leakage, or like, I think of like my friend who every time she like tries to jump on a trampoline, she just like pees herself, right? Is that is that like a foregone conclusion for people, or can you change it?
Great question. And this is part of the like the expansion, right? Because like for some people, you know, people know to do Kegels, pelvic floor contractions, because that's the only thing that we need to do. And so, in some people they work, and in a lot of people they don't. And the answer is why, right? So sometimes it's a strength issue. Sometimes we can actually have like a nerve damage, pressure damage, especially with like long standing pushing, or like the baby kind of gets stuck in a stage that can affect the way our sphincters and our pelvic floor work. Sometimes we can actually have a tear in very specific fascial layers, where I talk about fascia kind of being holistic. There are actually different layers that are like thicker. Like people know about their IT bands. That's a thicker tissue band. But we have this endopelvic fascia, and there are fascial layers that go between our bladder and our vagina and our rectum and the perineum and all of these things. And people can have tears, and when they do, it changes the structure, and organs can be where they're not supposed to be, which affects their ability to function and squeeze or not squeeze, or like there's so much that can happen. So pelvic floor physical therapy can really be helpful. Sometimes urogynecology, even more than gynecology or urology, because they're specialized in both things. Those people tend to be on the leading edge, although we're still trying to figure stuff out, right? It's not a foregone conclusion. And this is why I'm saying, like, try something. And if it's like not working for you, go back in a couple years, because we're learning, we're catching up. And I'm sorry that we are behind, but we can have a whole conversation about women's health not being funded. But
How about, I don't know if you're done with that thought, so I'm gonna like.
That's okay. Go ahead.
Okay, so what about guys? And so like thinking about like, I'm sorry if I say the anatomical muscles wrong or anything, but like PC muscle strengthening to increase stamina or endurance or control, and like trying to like maybe tap into the autonomic nervous system for sexual pleasure. Like how much is known about the guys? I mean, like.
So as much as we are behind it, and just really our understanding of pelvic health, and I always say men have way more research for every condition over women. I feel like we have a little bit more on women than men for pelvic health, because number one, there were more pelvic PTs that are women, right? And women are more likely to go get treatment. Okay. So like, and just some of the anatomical differences, but 100% I see men in my clinic. And there are plenty of pelvic PTs that see male patients. I see a lot of pelvic pain, a lot of chronic prostatitis, which is not really probably chronic prostatitis. People can be seen after prostate surgeries, because there's going to be functional challenges with that. When you said the PC muscle, I just like to say that's pubococcygeus, meaning it's a sling of muscles that is going from the pubic bone in the front and it loops back to the coccyx. There are even different muscles within that group. It's a really complex thing down there. But coming back to sexual health, which is really important to me, and this kind of ties back to your conversation, but to come to you when you're like for stamina and control and that sort of I say all the time, everything in this world is marketed about money and sex, but nobody's actually talking about money and sex, and they're certainly not talking about money and sex in their own lives.
100%.
Right?
Yeah.
So do you even know if stamina is a goal for your partner? Right? Like there are plenty of more women than men who are not having pleasurable sex. And stamina is not their goal. They want it to be done.
Oh, very sad.
Right? Now, hopefully through my work, we can change a whole lot of that because I think pleasure is important, but even our ideas about sex is very heteronormative. It is based on penis in vagina until male orgasm.
Right.
And that is sex.
Right.
Yeah.
Which has
for most people.
For too many people.
Yeah.
Yes. Certainly not all. God, please. Yes.
Yeah.
Yes. And this is what we're working on. But there's not even a conversation of like, is this what we want? Or are you satisfied? Or what would you like better? Right? Like, and I am, I don't know if lucky is the right word. There's lots of people young in their lives who are having sexual challenges because of pain or dysfunction. And I tell them, I'm like, I'm so sorry this is happening to you. And I could not be happier that we get to have this conversation because right now you're in a place where sex is a little challenging. So you and your partner have to talk about what's happening.
Yeah.
When sex just works for people in their young lives, they don't really talk about it. And they just kind of keep doing what works. And what happens is when you get into your 50s, 60s, 70s, 80s, 90s, some of that does not work the same way. And if you don't have any other tools in your repertoire or like conversations about how things are changing, people just drop their sex life.
Yeah, which is so wild.
Yeah.
I just had a conversation with a nurse practitioner, midwife, and a business owner. Anyways, I was at a women's group, and this may sound so like normal to other people, but I literally, the conversation was essentially about hormones because it was a functional medicine group.
Yep.
But I was just listening until they said, yeah, well, when you stop having sex, blah, 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 blah. And I was like, I'm sorry.
Excuse me?
I said, what?
Yeah.
And they were like, oh yeah, well, most, like, not most, but they were like, a lot of people do. And I was like, it didn't make any sense to me.
Yes.
And it's not in my plan.
Yes.
It will not be in my plan or my life, but also I was kind of like, they're like, yeah, sometimes it gets uncomfortable. It gets uncomfortable at some point is what they said, as if that was like a guaranteed thing. And then they just stop having sex. And I was like, for like the last 60 years of their life, like, I was like, whoa. And I think I literally had never heard anything so crazy before. I've never heard that before. I mean, maybe this is like common knowledge to people, but
it's not.
Yeah.
But there's also a lot of really easy fixes, right? Mm-hmm. And so part of the gift of my age is like I've gone through prenatal and like having babies and like early 30s, and now I'm perimenopausal, and like just as I prepared my daughter for when she was going to get her period, I was going to prepare myself for perimenopause and menopause. Like this, like it's happening. So like learn about it, right? So and this can go with part of your sex conversation or sex question that I'm still going to get back to, right? But in perimenopause or menopause, there can be a decrease in systemic estrogen, testosterone, progesterone, probably some others that we don't even know about because we still haven't studied it. But those are kind of the big three. Okay. But when I was talking about the pain conditions, I was talking about the actual tissue level. Your vagina, urethra, and bladder have a ton of estrogen and testosterone receptors. And when you do not have them, it is really common for people to start having some symptoms that we lump together in what we call the genitourinary syndrome of menopause, GSM, which used to be called vaginal atrophy, which used to be called senile vagina. So GSM is not a great thing, but like it's a thing. Okay. It's a little bit better, right? And I say this too, because there's also the genitourinary syndrome of lactation. So some of these things happen to people postpartum as well. So I think this is good. Yeah. But when you have a lack of estrogen or testosterone at those tissues, you start having issues of vaginal dryness, tissue fragility, urinary frequency, urinary urgency, UTIs, and sometimes like even bleeding after sex. So people will say it feels like sandpaper or glass, or it feels like I'm ripping, right? And I always say nobody wants to go to a crappy party. Like, so if sex is terrible, like you're like, well, I'll eat some ice cream. Like I'll get my dopamine another way. Thank you very much. Right. And I think that happens. And so vaginal estrogen cream, generic, which you can get for $15 for like 3 months from Mark Cuban's pharmacy, can change people's lives. They can have decreased urinary symptoms. They can sleep better because they're not having to get up in the night because they're peeing all the time. There can be better tissue quality. So sometimes my role is just to get people to the right people for support of tissue. Okay. Sorry. Can you tell I get a little like passionate about perimenopause and menopause? And I want to talk to you because like in menopause, like it's like a huge amount of women will lose a tooth within a couple of years of menopause because the estrogen and the mineralization of the bones. So I was like, oh, I had to talk to Wayne about that.
Absolutely.
Right. So we like, there is a huge thing that we're learning about what's going on with bone, with heart, with all these things with estrogen.
100% tell you that what's probably the hottest topic in functional and integrative right now is hormone replacement therapy.
Yes.
Right? It's everywhere.
Yes.
And as someone that relies on bone cells holding in screws in people's heads, there's a lot of people's bodies who have very altered healing responses now because they've started screwing with the system and it's not as tightly titrated as we maybe think it is.
Oh, well, we're going to have to talk about this. That's a whole other conversation, but let's just talk about this.
As a provider, you're like, I don't know the answer.
Right.
I don't know when I see something start acting different, I'm like, okay, that's different. You know, it's like when you're looking for pathology, they'll teach you like, you don't have to know the diagnosis that was out of your textbook from 20 years ago.
Right.
What you need to know is when something looks abnormal. And when you see something look abnormal, you should say, this is abnormal. And that's where I feel like a lot of providers are probably on this leading edge going, wait, whoa, hold on. Like, this is abnormal. That's something I'm seeing in my practice. And like, there's some abnormal healings from surgeries. And I believe I'm connecting a dot to some of the hormone replacement modalities.
I think we're going to have a conversation because I'm not sure I agree.
Yeah, cool.
Which is cool. And I don't think we know.
Yeah.
That's the thing is, I don't think we know yet. But yeah, there's all of that. Coming back to sex, because I love it. All right. You know how we were talking earlier about how we're trained to like not feel? Okay. One of the most important things in pleasure is being able to feel.
Yeah.
And I think that we have trained ourselves to not feel when we're hungry. We don't give our body the things it's asking for any number of reasons. And why do we think pleasure and connection in the most sacred of energetic places would be any different? So there is so much like, I'm not pro-porn. I'm not anti-porn. Porn is what it is. But if that is your sexual education, that is never going to be, or it's very rarely female pleasure centric or actually like reality of what's happening. And if that creates sexual patterning within a brain for arousal for our young people, that can screw with things a little bit.
Oh, yeah.
Right?
For sure.
But most people are just not in their bodies. And so like, how are we going to have sexual pleasure when you're not in your body?
Yeah, it gets back to the whole like divorcing yourself from your body. It's the same exact thing. Like,
exactly.
Like if you just believe if I mean, this is probably like so common. It's like the boy learns about sex from porn, right?
Mm-hmm.
The girl learns zero about sex. Then they have sex. The girl now thinks this is like what sex
The
is.
way it is.
The boy's like, did it just like the video,
Yeah.
you know, like I win. And then you go on forever and ever. And well, what do you do? Like they're not listening. I'm not you, but like the man isn't listening to their brain or body about like, you know, it's probably not really that satisfying because the female is not really satisfied typically. I mean, unless you get lucky, but like, and then the woman is like convincing themselves that they like something that they don't, you know, that they're getting some sort of pleasure at, and they're usually not, right? So yeah, I mean, it's all goes back to,
I always like to say commonly instead of usually. Like, it's common, it's not normal, it's not usual,
Yes,
and like we can
yes.
have conversations. But like, I don't want to disempower women further about like their pleasure
agree.
being hard or
Yes.
like harder to achieve. Like, I once heard like somebody talking about like the elusive female orgasm, and they're like, is that really true?
No.
Like, because if we were to like take a male and say, okay, we're not going to stimulate any of your pleasure areas.
Yeah.
What's wrong with your orgasm? Like, why? Like, because the wrong things are being stimulated. Like, sometimes there has to be an education about like the anatomy and structure of their body. Like, most people have no idea that the clitoris is exactly the same embryologic tissue as the penis.
Yeah.
And like what they think of as the clitoris is just the very tip, which is the exact embryological same tissue as the tip of the penis.
Yeah.
But the entirety of the, sorry, menopausal brain, like the arousal tissue is living like underneath in females, but it's huge. The clitoris is huge. If you've not really actually looked at the anatomy of the clitoris, I can't imagine. Like, please go check it out.
Yeah.
Yeah.
Yeah. I mean, it goes back to knowing your own body first.
Yes.
Knowing how to listen to it.
Yes.
And then you have to be able to communicate that to somebody. And that's like, you know, that's just not, there's very few, or I think the number of people that get that kind of education young is small.
And as parents, there becomes this question of like, okay, well, because like
am I going to make my kids want to have sex if I teach them about
right,
sex?
and like our sexual relationship evolved so much after we'd been married for a while, and then we really started diving into it and trying to learn more and talking about more and realizing that the porn is not what the porn style wasn't pleasuring.
I mean, maybe it is for some people.
Yeah,
like,
sure,
like
or at times or whatever. But like this like conversation of talking about it and exploring like other schools of thought, right, evolved our experience. I mean, it's drastically different now than it was 10 years ago. But then, like, so I was saying, like, if your kids aren't, where do your kids get that? How do you teach them so that they have a great experience with their partners? And because it really empowers the whole relationship to open up.
Yeah, I think there's a piece that you can try, like, and there's a piece where your children are just going to be mortified. Like, I mean, like, I can do all of this, but I have a teenager. She does not want to hear this from me, right? Like, she'd rather die. But like, and I told her, I was like, I want to know about your sexual life about as much as you want to know about mine.
Yeah.
Right. And it's really important to me that you have a good sexual relationship. Right. So do you give them resources? Like, do I tab them? Did I give a book and tab it? Yes. Is it in the back of a closet? 100%. May she never pull it out? Maybe she will. I should die if I was talking about her. But I think that there's a certain amount, though, that you just got to do stuff wrong and be curious about how to get it better. Like, I don't know that you can be a rock star right out of the gate. You have to like fumble a little bit.
Yeah. And maybe just planting the seed that like education in every aspect of your life doesn't stop you. You just try to always grow, learn, be better, explore all these areas because that's an important one.
Let me ask about a jade egg. So
Yeah.
I am a huge fan, just putting that out there. I'm
Yeah.
curious from and I feel like for a long time it was like people thought you like use a jade egg, you like walk around with it for days, but that's not, it's like an exercise tool for those that do not know, to provide some like feedback essentially, for strengthening your pelvic floor and just kind of like waking up that tissue. Is that something like, do you have thoughts or like, I don't know, what's your opinion about using a jade egg?
I describe any kind of tool as a tool. So I always say a hammer, you can like lightly tap a nail into the wall, or you can bash somebody's skull in. It's the same tool, but used in very different ways has very different effects. Does that make sense? So the jade egg or a foam roll or pelvic floor, like they're all tools, and depending on how you're using them and how it's working for you is very different and individual. Okay. So there are a lot of like within, like, I have to like just notice my training and my like pearl clutching, like of training of like, oh my God, people are not cleaning them, bacterial, blah, blah, blah. And I was like, I'm not worried about that. But how people are using them matters. So if you're using them as a tool for awareness and connection to that place and you're feeling it, I think that's probably the best case use model for something like that. And so I say, great, carry on. Would I say it's for everyone? Absolutely not. Are there many reasons why people would not have success with it? 100%. And so nothing is an all or nothing. But if it's working for you and you understand, awesome. But might not work for other people in the same way. So this is be careful of what we're prescribing to everybody else.
Yeah, that's interesting. I have a friend who, just from my experience and me telling her about it, was like tried it and she couldn't even get it in. So it was like she just can't use it. Like her body was having like a no reaction to even like inserting the egg, which is right. We're all different. So, I mean,
yes, there's a whole like, there's vaginismus, which is a whole condition. Sometimes people can have like avulsions of the muscle during childbirth where they could get it in, but they couldn't hold it in because like there's no muscle support and it's going to fall out. Like there are so many different things that you kind of have to know where people are. And that's where the nuance of what I do comes in a lot.
Yeah. So interesting.
Yeah.
I have a quick question I want to ask, like, practitioner, like let's say for dentists, maybe like, do you, like, let's say I'm in my office, I put like a pull-up bar in there, I have foam rollers, I have bands, and like, but like if you were to, we've just been talking about how individualized all these prescriptions are, but if we're going to step back and go very generalized here, and you have people that maybe the hairdressers, dentist, or people that work in hard posture jobs, do you have like a favorite like tool to put in your office or a favorite exercise to do? And we can even just narrow it down to dentists if it makes it easier, like people that lean forward and bend over.
I think 10 years ago, I would have told you, and I probably did, like rolling up a blanket and put it under your spine and like laying over it to kind of get you out of that position would be great. And I think that's still true. Like I like to think about if you're in a position of repetitive motion, like what position is this? And then can we work to like kind of balance that a little bit, and maybe not in the extremes of it. So if you're forward, maybe you're coming open a little bit, but not all the way open where you feel like you're going to die, right? It's like, just give it a little break. Can we come back to the middle, right? I think now, as I'm coming back and like integrating a little bit more of my PT self that I had to disassociate with as I was learning the myofascial piece, I really go, okay, like, yes, we could do stretches. And then what are the movement patterns and systems, or how could we maybe use a better sequence or coordination of different muscle groups to do the same thing, but it feels very different, and where the movement is coming from is very different. That's a really hard thing to scale and to give a basic.
Yeah. How about belly in the ball? That's something you taught me.
Yeah.
I don't know if you, I think you were the one that told me about this.
Yeah.
And like I hurt my back last week, and one of the first things I did was belly in the ball. Like,
yes.
And
did it help?
Yes. When my back only hurt for one day, it was,
100%. So there's this little 4-inch kind of Sport Time makes one called the All Ball that's like 4 inches. Like, that's the one you can get on Amazon. So I'll tell people. And you can inflate it to different inflation rates. And I would have people just lie on their belly and put the ball in different spots and feel a spot that's hot, hard, or tender, and then wait till it wasn't hot, hard, or tender anymore. And I think that you do get some visceral work. You get maybe some psoas release. You're also stopping, feeling your body, connecting, listening. You have nervous system input. You're putting yourself in a different position. So is it just the ball? Maybe not, right? So it's like sometimes we're doing things, but we're doing multiple things with the one thing.
Yeah, I'll usually find somewhere really uncomfortable, and it will make me breathe.
Right.
Like, which I think is a big part of that is like, oh.
Yes, where is this connecting? Where am I feeling this? Ooh, can I give it a different connection?
So if you were going to take care of, I mean, as we've talked through this, it's like, it feels silly to say to take care of our fascia, because obviously it's all connected, right? But what's like a tool or a technique, if you could give everybody one thing to take care of kind of fascia, but also like whole body health, like what's your go-to tool, technique, tip?
It's changed over years. Okay. If you're feeling someplace in your body that is giving you a sensation, I really wish this wasn't true, and I really wish it wasn't this simple, but I really think that there is some simplicity to this.
Let's hear it. I can't wait.
The first thing I do is I say thank you to it. Because I know that my body is always on my team. And whatever it's doing, like if I have a knot, usually it's in a small muscle, and that small muscle has been doing Herculean jobs because maybe a larger muscle group isn't in that coordination and timing, but it loves you so much that it's going to do you for it and do it for you. And it loves you so much that when it is at the end of its rope, it will tie a knot in that end to keep you functioning. And we just try and beat the hell out of it with a lacrosse ball, right? And so now we have taken away the body strategy of how it is helping us without supporting it so it doesn't have to do it. So I have really kind of, as silly, as simple as this sounds, is the first thing I like to say is like, oh my God, you are doing such an amazing job. You are just keeping me going. You are incredible. I can't believe you do this. Okay. I also hear that you're not loving this. Fair. Okay. Can you show me where I might need to support you? And listen to that for support. Okay. But that is higher level, foam rolls, tennis balls. If that's where you are, that's great. But over time, you're going to get better. But if you use the foam roll or the tennis ball or the lacrosse ball, which are, again, some of the most common, what I would say is when you're coming into the tissue, only come into it until where you barely feel it, not the most intense, right? Unless you're trying to get right back to sport and you're just trying to kill the symptoms so you can get through the next 10 minutes. That's fine, okay? But if you're trying to change the tissue, you're going to engage it until you just barely feel it. And then you're going to wait. And you're going to feel, does this start to connect into other places in my body, or does it just stay here? If I breathe and soften it, does it start to shift and change? As it shifts and changes, does my body even want to move maybe in different three-dimensional movement patterns? Like, where does this go? And keep following it until it feels better. It's not, it's much more simple than we make it, but that doesn't mean it's easy.
What about hydration? Would you say that's important?
Yes. And maybe less than we think. Like, I think that, again, being a pelvic PT with all these people with bladder problems, like, and they're like telling me they have like bladder urgency, and then they tell me they're drinking like 2 gallons of water a day. I was like, well, that'll do it. Like, you're going to have to pee, right? Oh, and you're eating all these fruits and vegetables too. Okay. That's a lot of water in your system, right? I don't think we're as dehydrated as we think we are.
Cool.
I really don't.
That's cool. It's interesting.
And it's like, and even like, you can't even trust your thirst to tell you when you're, I'm like, yes, you can. Like, unless you are in heat and you're doing like physical activity, that's when you need to preload. But if you're just running around in your day, when you're thirsty, take a sip of water. You don't have to chug 8 ounces. In fact, your body can't process it if you do. So just take a sip of water when you're thirsty.
Yeah. I like that.
Incredible advice.
I mean, like, come on, people. Like, we don't have to not trust our body.
We've been talking about listening to our bodies.
Yes.
So, I mean, I think that is right in line with that.
Yeah.
Okay, last thing. What's something that you would stop doing that you wish people would stop doing that's wrecking their bodies?
Well, like a wellness trend that's like hot.
Yeah, could be.
Yeah, okay.
Or something you see often that you're just like, that's not it.
I just wish people would stop hating their bodies or thinking their bodies are deficient. In a nutshell. Yeah. Like, marketing is designed to make you feel worse about yourself. And rarely is it true. So, like, I just want people to know that they're probably pretty okay.
Yeah.
And to trust their bodies when they're telling them they're not, and going to get help. But even like, I love going back to tools, and like, there's this whole push of the millennials for optimization, right? What the hell does that mean? Like, seriously, I don't know what that means. For what and to what end, right? So, like, I love all the trackables if it's helping you make decisions, or it's like bringing awareness. But like, people live their life, they're showing me their 5 tracking apps on their phone. I'm not 5. And they're like, oh, this. I was like,
that kind of stuff gives me anxiety to think about having to meet all those metrics.
You are giving your brilliant biofeedback system, you're disconnecting from it. Like, don't disconnect from your body because you have a tool or something is telling you to do something. Like, nobody knows better than you.
Yeah.
Well said.
Well said. And maybe a good place to end. Nobody knows better than you.
Yeah.
This has been so fun.
Yes.
Do you want to plug anything? Do you have anything going on? Like, obviously your practice.
Yes.
Central Texas Myofascial.
Yes. So Central Texas Myofascial Release is here in Austin.
Yeah.
You know, I've done different programs over time, and I'm kind of coming back because what I realize is I love, what feeds me is one-on-one interaction. And I'm not going to be helping everybody in this world, and that's okay. Like, if we're meant to connect, we will.
Yeah.
Come see me if you need to.
Cool.
Yeah.
Okay. Well, I definitely highly recommend, if you're in Austin.
Yeah, I referred someone to you yesterday.
I probably do it. Like, I probably do it twice a week, and I need to come see you myself because I just love being in your presence. So thank you so much for being here.
Absolutely.
And for taking the time. This is awesome.
Keep doing amazing work. Like I said before, like, the reason I love you too is because you really care and you're trying to not only improve yourselves, but improve the life of people around you. And like, that's really meaningful work and can feel sloggy sometimes. But like, just keep shining your light and people who are meant to follow you will.
Thank you so much.
Thank you.
That means a lot.
Yeah.
Yeah. Awesome.
Yeah.
Awesome.
What a good note to end on.
There we go. That was
All
fun.
done.